Hi, my name is Sukanya Sarangi and I'm going to present on the topic oral care strategies in patients in intensive care units. To start with, oral care is one of the most fundamental aspects that impacts the health, comfort and well-being of the patient in ICU. As we know, ICU patients are immunocompromised. They're highly prone to oral candidiasis and herpes simplex, and also they have medical conditions, for example, diabetes and anemia, which has its own oral complications. So these patients are also on intubators. So the use of these intubators leads to shift of the oral flora from the gram positive to the gram negative, which causes xerostomia and mucositis. Inadequate oral care can predispose the ICU patients to infections, and one of the most important out of them is the ventilator-associated pneumonia. It is one of the most common nosocomial infection, and it's mostly seen in mechanically intubated patients. Oral care implications by nurses and ICU can prevent this condition, and daily measures like adequate toothbrushing, use of mouthwashes, and also daily oral assessment will help in preventing this condition. So the main goal is to prevent the proliferation of the bacterial plaque. Several studies have been done to check the assessment for oral hygiene, and toothbrush is found to be the most effective tool. Adequate hand washing can be implemented, and since the ventilator associated pneumonia mostly spreads through micro aspirations, so the use of chlorhexidine will reduce the spread of the infections. Patient head should be elevated at least 30 degrees unless medically contraindicated, so that the oral secretion will pool directly into the buccal pocket and will prevent the reflux and aspiration. So in a nutshell, I would like to conclude that nurses are the direct caregivers of patient in ICU, and making them aware with adequate oral practice can reduce the incidence of ventilator associated pneumonia, which is a serious condition, but it is also preventable when taken adequate measures.